Hi, I'm Dr. Roadhouse, and I want to introduce you to my patient Veda. Do you want to just talk a little bit about where you were when you first came in, um, and what your symptoms were, and how we progressed?
Okay. When I first came in here, I had severe pain across the hip and down the right leg, clear to the ankle. And I was using a walker for balance, for my instability and things like that, and the weakness I was suffering in my right leg. Uh, and that has progressed gradually over the weeks that we've been doing this. Uh, the pain, it took it probably 6 weeks, maybe no, 8 weeks, 8 to 10 weeks to go kind of relieved of where it was tolerable, and I did without any medication or anything like that. And I was able to give up the walker because I didn't need it for stability at the same time. Uh,
And the leg got stronger
the
too,
leg
right?
has gotten stronger, and now, and this is what, 6 months,
Mm-hmm.
or 5.5 months, something like that. The pain is gone from the leg, and I feel twinges in the hip occasionally, but it's as I'm turning one way or another, or as I'm uh, just doing something a little different sometimes, but it never lasts. It goes away right away. And as long as I don't try to over exercise or push myself to do more than I can do, I do well. And I
And
know when I've done
yeah.
too much.
Well, now you're just on a checkup basis because
Okay.
you've had it for a long time, and so we
Right.
want to make sure we've got 95% of it fixed.
Mm-hmm.
So when you, how long did you have it before you came in to see us?
I fell with a hypoglycemic episode the last week of September. And through the month of October, I knew something. I didn't realize I'd hurt myself. And during the month of October, I'm a bowler, so I noticed that after I would bowl on a Sunday evening, it would take me a couple of days before my hip would feel it hurt to stand on it, and it continued to get worse. By the 1st of November, it was hurting more and more. As I saw my internist, Dr. Markle, he ordered some spinal X-rays, and he thought I had probably was the promiscuous muscle was pressuring on the sciatic nerve. He suggested some exercises and some things for me to do. These did not help. As I have found out later, that wasn't the way to go. But we tried that first, and it did not progress well. And due to a recommend of a friend of mine, I wound up here.
Okay. So when you had it for in your leg, how long? I can't remember. When did you come in to see us?
I saw you the first time in mid-December, and
Okay,
you were
all right,
going for
yeah.
2 weeks vacation
Right,
and
yeah,
Christmas. So
yeah.
we started treatment January 4th.
Right, yeah. So and so you had it,
Since October.
right? Yeah, okay, good.
Yeah.
Did he give you any muscle relaxant pain pills or anything like
He
that?
didn't give me any muscle relaxants, but he did give me hydrocodone with
Mhm.
acetaminophen to use every 6 hours. Well, I'm kind of hard-headed. I don't use things that often
Yeah.
because I don't like the feeling that goes with them.
Mhm.
So I
And
used
plus,
them every 8 to 10 hours.
and it wasn't really getting rid of all the
No,
pain anyway.
it
So
made it tolerable,
right, yeah.
but it didn't accomplish anything. And
Mhm.
he was honest. He said it probably wouldn't,
Mhm.
but at least it made it tolerable,
Yeah.
and I could, you know, move forward. Well, I stopped taking that in mid-February.
Mhm.
I had gotten to the point where I thought, no, it's time to stop. I'll go to Tylenol and Aleve and work with that. And I did that then until about the 1st of April.
Mhm.
And after that, I've discontinued all over-the-counter meds and everything.
And it's going to take a little bit of time for the ligaments to heal because this,
Yeah.
we went when it, they graded 1 to the hip, 2 to
Mhm.
the knee, 3 to the foot. So yours was a full blown 3.
Right.
And so it's going to take a little bit longer. And right now, the nerve probably isn't still all the way healed. That's why,
I don't think it is either.
yeah. And we went a whole month,
Mhm.
and we're going to check you today, and then we'll probably have you come in another month, maybe 2 or 3 times, and then hopefully we just want to maintain it and make sure it's in good shape.
Okay.
So what have you seen as far as I mean, because you were there bringing her and
All the
helping her
time.
up, yeah, and
Yeah.
pulling the car up and dropping her off at the porta and
Yeah.
so what have you
Well,
seen?
beginning in the last part of November, there was something really serious that she needed needed treatment for for something, and it really had her incapacitated as much as ever seen her. She was really hurting,
Well, I remember just from her, you dropped her off to get in, took her a couple of minutes to get in,
yeah.
and then just me calling her back from where she was to get in the room took
Right,
a little bit of time
Oh,
too.
yeah.
She
Right.
wasn't, you weren't going to win any races,
No,
that's for
I
sure.
wasn't. And getting up and down was difficult.
Right.
As I was sitting, it was fine. As standing, I was fine. But the process
Yeah.
in between
And we talked
was
about that.
really hard.
That's when it was
And
pinching
the
that
walker
nerve.
was what I needed for, just for the stability
Yeah.
to keep from falling again, so that I didn't fall down anymore.
Yeah.
And because I didn't think I could afford to do that.
And there's probably other things around the house that she just couldn't do.
Oh, I didn't do
no, she
anything.
didn't,
Yeah.
He did everything.
Yeah.
He did all the house
And-
cleaning and all
yeah.
of the stuff like that.
Yeah.
Grocery shopping. I did not. I don't think I left the house except to come to your office for the whole month of January and February. I went nowhere.
She's really
Yeah.
changed.
Yeah.
And that's not my
Yeah.
cohort.
No, you're a go getter.
I'm
know
willing to do
that.
things.
Yeah.
I
So that
don't.
had to be hard
Yeah.
dealing
it
with her
was.
because she couldn't do anything.
Yeah.
I mean, because it's frustrating for someone that wants to get up. I mean, because you
I
other than
see
that,
things
you're in
that I
great
wanted
shape.
to do,
Right, yeah. You just couldn't
and I
do it.
didn't need to ask him to do. He has a lot of other things going on too, and it was unfair to ask him to do all those things. I mean, gee whiz, there's a limit to what you could do.
One example, she would, go from the bedroom to her recliner chair and to the bathroom.
That was it
about
for
all.
several weeks.
And her recliner chair soon discovered it wasn't adequate in that she had to push it back to recline. So we
Kept irritating
part of
that. Yeah, we got rid of that.
We got rid of that and went to the electric chair.
Electric recliner chair, wasn't a lift chair, but one that had the electric
And I was,
assist.
More
realized-
smooth than yeah.
I will say the thing I noticed the most from the very first time we started until just recently, the ice, 15 minutes on and 45 minutes off, all waking hours, was fantastic.
Yeah. And that's
Because it relieved
Yeah.
the discomfort.
Yeah.
It
and that's
relieved-
one of the ways
Yeah.
that, like when patients come in, and they put heat on there and it's gotten worse. See, if it was muscle, it would have been, like he said, a performance muscle,
Yeah.
would have been better in 2 weeks,
Right.
But when you put the heat on there, it didn't help. And then you put the ice on. Ice helps with the pinched nerve. The nerve is inflamed, it shrinks it down. So that
Okay.
also helps us in understanding. And any other patients, if
Yeah.
they have prospective patients, we tell them, well, try the ice first. If that relieves it, then we know we're dealing with
Right.
the pinched
Well,
nerve.
I didn't understand how much the ice would help until I did it.
Right, yeah.
And then
Yeah, it doesn't seem like
I was
nothing
very
else.
conscientious about doing it all the time.
Before we come to you, she went to the chiropractor I usually go to, and he's more of an athlete type thing, and he always recommending ice, but he said, put it on and, leave
For
it
30
on for
minutes.
30 minutes, an hour or something
And
like that.
and
so
I
long.
discovered right quick that was too long.
Right, yeah.
And I did it from the time I got up in the morning until I went to bed at night.
Well, I mean, if something
And,
works, and,
yeah,
and it makes my job easier, and
Well, and it
Makes you
made
feel
me
better.
more comfortable.
right.
I could tolerate being up in the chair and things like that, which I couldn't otherwise.
Yeah.
I just could not tolerate it. And in spite of that, there were days when it was really hard.
Mhm.
But I didn't give up on it. I
Yeah.
just kept plugging away. And I still now use the heat
Mhm.
twice a day and with the ice following it. 10
Right.
minutes heat, 10
Because we're
minutes
trying
ice.
to get those muscles through,
And
make sure they're
get them to
relaxing.
relax
Yeah.
enough for me to be able to walk and to move around the house. And I can now. I can go upstairs once every 3 or 4 days.
Mhm.
I don't do it often. I go up once, down once. That's
Yeah.
it. I'm through.
Yeah. Well, you don't want to push it,
But I do it on when I'm feeling well, and it seems like it's a thing I can do, and I know how it feels, and by that time, and it works well. I haven't had any problem
Well,
there.
we're gonna check you today, and
Okay.
we're gonna check you again in a month, okay? And
Okay.
then we'll make sure we're just fine tuning right now. But before we go, what I'd like to do is just have you stand up so everybody can see how good you can get up now. Cause this, look at that.
Oh yeah, I didn't do that before.
No.
No, and I didn't walk well. I felt very unstable in
Yeah.
walking.
Yeah, now your legs are strong,
Oh
you got
yeah,
full nurse
I
support.
don't have
Okay,
any problem
good.
at all. Now, I will trip easily because I've lost strength in my legs.
Yeah.
So I have to be real careful with that.
Yeah.
But,
I'll give you some exercise to help with that.
but I do the exercises on the door, sliding up and down. I do
Yeah.
those.
Yeah.
And
You gotta start somewhere. You haven't been able to do anything for
no,
so
I
many,
couldn't
you know.
do that. And
Yeah.
I thought I have to work up a little bit of strength. And I got to start somewhere.
Yeah.
So I do that very regularly.
All right, well, let's go
Okay,
get you
good.
adjusted.
All
Thank
right.
you.
Mhm.